Okay. Hello. Okay. So I wanted to explain something here concerning the blueprint. Okay. I said I want to go a little bit deeper into the blueprint. Okay. So I just wanted to say that the blueprint will help you a lot. I see a lot of people will come on my thing and comment, oh, you got to go see this guy, you got to go do this one and this and that. I'm not doing it. Okay. Because when I started, at the time when I was doing my study for my exam, people would say all kind of things. Like they would give me some website, they would tell me to go check the video and go check this video. Just listening to me, what I'm trying to tell you. So if you that person when somebody come to you and say go check the video, go listen to this person, you can do that. Okay. But the thing is, at the end of the day, you will just get yourself confused. If you want to pass the thing, this exam, you just stick to what you're doing right now. I tell people, maybe in my previous video, I did mention it, but I didn't go deep into that. When you get yourself the blueprint, which is free, you can Google it and you will find it on Google and download it somewhere on your desktop or whatsoever you have there. You pay attention to that blueprint. Okay. That blueprint will help you be successful in your exam. Hear me. With the blueprint, they have everything. They tell you everything you need to know and where all these questions coming from in the blueprint. The blueprint, it has an example, the question, example of this question and all the applied questions all in the blueprint. You take that blueprint, put it on your desktop and get your you were there, like side by side, something like that. Take your time. Okay, I just came up here because I had a good news. One of the ladies that reached out to me from YouTube, she reached out to me and she asked me a question. I just told her, stick to what you're doing. Don't let anybody come in to tell you, go look at this one, go look at that one. Oh, okay, go read that one. I said, don't do it. If you have your books, if you have that Moby book, and uh, um, and if you have the Rexpian and you have um your you were, you okay. Everything on there with other people they sending you to, it's the same thing. Nothing changed in nursing. Okay, all the same concept. There's nothing that changed. It's the same thing people making video or people talking about. You have to say, you know what? I have some resources here. It's the same thing people talking about. You can go there and listen to them and come back to what you have and start studying and start reading. Like I always say, read. Don't run through it and you think that automatically you're going to stick in your hair or you're going to just remain there. You have to read. Reading, it helps to take in most of the things that you're looking at and most of um, the information you're getting into, trying to acquire all this kind of thing. You have to read. You don't take shocker on that when you're studying. Don't try to take shocker and say, oh yeah, okay, I get it, I'm going, oh yeah, I'm going to go take the test. No, take your time. That's what I said. Go, go read the blueprint. Get the blueprint, and I'm telling you, it's like the blueprint and everything in the blueprint is on your word. It's on your word. So tell me, where maybe other things, because I refuse to look at other things because I just felt all the same. There is nothing more than the other one. It's the same thing. Whether it can be 1,000 to 3,000 questions, all the same. It just had the English changed a little bit here and there. Okay. I just giving you my little advice. Today, the other lady I talked to, I kind of sat with her and talked to her and kind of like tell her, say, this is what you should do. Don't pay attention to anything. If I what I tell you, if you do it, you'll be successful in the test. And she said, okay, I will listen to you. And this morning she called me. I got up, I was just lying there in bed, and I saw her name on my phone. I was like, oh, what's up? I picked up the phone and she said, oh, I just want to say thank you. And I said, what happened? What happened? She said, I passed my Rexpian exam. And I was just screaming because I was like, oh my goodness, that's a good news to get out of bed with, because she said, I want to say thank you to you, Rose, because you told me stay with what you have and steady. And that's just what I did. And I told her, get you were, and she got it. And she said, I got the other book. I said, you go ahead. Because if anybody come and tell you, say, go look at the thing, buy this book, you're wasting money. You can go listen to other lecture. All the lecture the people having, they didn't take it from anywhere. They take it from a book, which is the same thing. All the subject, all the topics are in the book. Whether they're reading it from their book or whatsoever book they had there or they have, it's all from the nursing book. Your nursing book you have, you will see the same thing they're talking about in that video. It's good to go listen to the lecture. I'm not saying don't go listen to the lecture. I'm saying don't get yourself confused and people pulling you here and there, and then you get distracted. What you had before you, because it's the same thing. Nothing changes in nursing. Nothing. Okay, it's the same thing you have in your book. It's the same thing on your work. You will go listen to that lecture. It's the same thing that you will see. You go listen to the other lecture over there. It's the same thing. Okay, nursing. There's nothing. Nursing being the same. It's not like okay, you're reading from you were. It's then you go read something different. It's the same thing, man. I mean, trust me. I did them all. And then she stuck to it. This girl, she stuck to it. She had her you word. She had the book there, and she was just reading. She just locked herself into those two resources she had. And she said, "I just keep reading, doing my question, keep reading, doing my thing." And she said, "I took my test yesterday by 4 o'clock this morning." She said, I couldn't sleep. I was just waiting. At 4 this morning, I got an email congratulating me. I passed my exam. I was like, I just did a little part of that. You did the work. You did all that work. You took the time to study. This girl got a baby. You took the time to steady and not giving up and not being frustrated, and you stick to your gun and you stick to that and say, this is what I'm going to do. And that's just what she did. And she passed. Like, so, I mean, my little channel here, I got 5 people that already call me, reported to me, that they thank God they came across my video and they were able to get in contact with me and I able to coach them how to, get into this thing and just go. 5 people already passed, like passed. Okay. Just telling you what I'm telling you right here. And there's nothing else I'm telling you. I don't have any big lecture and say, hey, this, that. No, I'm just telling you simple things. Once you get your U word, you get your book there, okay, the Canadian European exam book or the Rexpian book and your U word, and then you bury your head in those things, resources and get reading. I'm telling you, there's nothing else I can tell you. Say, go look at that other read, go look. No, You can go do it yourself. Go look at the lecture and other people. It's the same thing you see in your book. The same thing you reading in your book. If you are reading, it's the same lecture these people giving out there. There is nothing else they're giving but the same thing that is in the book. Okay? And that's what they keep telling you. They just expand on it and just, blah, 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 blah. Take your time, put your head in what you have, your U word and your Canadian PN exam book, and just keep studying because all these questions there. I mean, and then when you get your blueprint, look at your blueprint. The blueprint is what she was telling me this morning. I just got something for her. She said, I said that you check out the blueprint because I told her to download the blueprint. I said, one day it just got in my mind. I called her right away. I said, hey, download the blueprint. I should have told you that. And she said, yeah, I download the blueprint. She said, every time she log in the blueprint, she go to her U word for the topic and then she go and study and go read and do work there. You know, she I mean, she was telling me, she said, I was so happy for her. Like it was me because it just took me uh, back to the day I got my exam result that morning because I took it on Friday. I did not sleep. Yeah, I was off and on sleeping, but then at 4 o'clock, I just saw that bing. Like I was like, oh my goodness, girl. I was even scared to look at the email, but then finally I just got that courage to just look. And yeah, it said that's where I saw that email and congratulated me. She said when I saw it this morning, she said I was so happy. I just thank God she told me, and we all were just and she and myself just rejoicing in her joy, because when you pass that, it just some kind of feeling, some kind of joy that is contagious. That's what you can have, so I just want to say, let's go deep into the blueprint and try to not, and say that like, oh, it's too much for me to look through, how can I look through all of these things here? Yeah, you want to pass, you have to look through. It just like you just have to be little bit patient. Go through that, low for like she was telling me she found advanced directed in a blueprint and she went on UWord and she read about it and she said she was just reading. And then one thing I told her, I said, hey, um infection control, I said, look at that, read that and read and read that and read that again and read it again. Like get in your head, go do the test. Once you see yourself going, you get 60 to 70% correct. Yes, you're there. And she said, I just went there on you and I was just reading and reading and reading. This is what the girl was telling me today, this morning. And I'm really happy for her that she finally got her license. And she was just, I still remember what she said this morning. She said, I just thank God that I came across your video. She said, I thank God I came across your video. I just thank God for that. And I thank you so, so much. I said, I don't know. I said, I'm so happy for you right now that I don't even know what to say because it's just a little small channel with few people. But I mean, like people, when they talk to me, they feel happy because I tell you, I'm not saying, oh, give me money for me to tell you this. I just tell you from my experience. I sit with you, not sitting with you, but on the phone, we talk. And when I was talking with a lady, I was just telling her, I said, if you will do what I'm telling you, you will pass the exam. Just do exactly what I'm telling you. Because I did it for myself. And on my first attempt, I passed. So if you do it, and this is her first attempt and she passed. So this girl was really serious, studying. I mean, like she went after it, like her life depend on this thing. So I'm just trying to say that the blueprint going to help you when you go through the blueprint. It has every topic or every chapter that you're supposed to know about, because it will tell you in the blueprint, say this chapter, this is the percentage of question going to come from this chapter. If that care and basic care and comfort, they will tell you, say this is the question, um, this is the percentage of question coming out of this topic or out of this chapter. If that advanced directive, it will tell you, say this is the percentage of questions coming out of this chapter or this topic. Okay, so they tell you, they didn't hide it from you. They tell you everything to get you prepared well. Okay, they make you to know, say this is the amount of question coming out of this topic, this is the amount of question coming out of this topic. It left for you to take it serious and say, let me read. If you find it too much, like, okay, the chapter is too much. And one thing she told me, she said, I did not get maternity. That's what she said. She said, I didn't get maternity, but I got lots of infection control questions. That's what she said. She said, I got lots of infection control questions. And I only have one math question, but majority were infection control. And then I remember telling her, say, on you or infection control is about 265, if I'm not mistaken, 60, between 60 and 65. I said, do not leave anything over. Read all those questions, do all the uh, read the text there and go through all the questions. I said, don't leave anything and go back again and read and go back again and read until you get it. That you say, hey, I get it. I don't need to go back there and read that chapter anymore. Okay. And so she was very, very determined. The girl wanted her license. She was very determined. And finally, this morning, she got her result and she passed. Okay. So, so if you want to really pass on your first attempt, get that blueprint, go put it on your desktop, get your U word there, and get your Canadian PM. Your Canadian PM, like right now, I someone came on Sunday and borrowed it. One of the girls also talking to me. I met from YouTube. She came to my house. I gave her some resources for her to study. Get the those books. Get your U word. I will tell people, you are not paying me. I get no pay for you work, but I'm telling you how good it is to prepare you for your exam. So that's why I can tell people that contact me from YouTube or my friends that in school that are about to finish school, get your U work. If you're getting it for a month, if you're getting it for a 3 month, go get it. At the time when I got you work, I got it for 3 months because that was the time I gave myself to get everything, I mean, to prepare myself and go do my exam. So if you think you have that confidence to say, I can take 1 month, and within 1 month time, I will be well prepared and ready to go do my test. And I mean, like you and me, I mean, you know yourself better than me. So if you think in a month time you can be ready to go do your exam, you can take 1 month. But if you know, like me, I took 3 months and I felt within 3 months time I will be ready, and then go and do your 3 months. But don't waste money if you know you can do it in your month. But if you cannot and you just starting, it's better for you to put in for 3 months, for real, for 3 months. And if you just starting, like I don't know where to start, and I just started, thinking where can I start, where can I begin with this whole thing. I would tell you, say, if you come across my video right now, I would tell you, say, hey girl, download the blueprint, read through the blueprint, go get yourself the U word. You can take subscribe for like 2 3 months. It depends on you how fast you are or how well you can take in. If you have the Canadian a PN exam book, they call it the Mosby book. The name most people say Mosby. If you can get that one, has you say has your reference, that is great. If you can get the Rex PN practice questions, let's say about 1,000 questions, that is also great. If you can't get the two books at the same time, but you can get one, then the other, that is also good. But the Mosby book, I always tell people, is a good reference for me. That one because they have all the questions, all the chapters in it, where you can have good summary, like good orientation to me, something like that. But if you don't have that one, that you were there, and if you get the recipe and practice question, that is also okay. If you can get yourself any other resources, that is also okay. Like if you go listen to someone, or you get someone a video sent to you that you can listen to the video, just preparing yourself, that is also okay. But I'm saying when you're getting all this information from left and right, how can you kind of merge them together, like merge them and try to um and start studying them. So if you say, okay, I listen to this guy, I want to go listen to him again, go listen to him, make a note. I used to go there. I'm not discouraging for not doing. Make your own note, what it's saying, make your note, bring your note to your study place, go through the notes, and compare. If the person was talking about some chapter, maybe talking about MS or something like that, go through it, you know, in your book, look for that chapter or that subject and start reading it, because you listen to it, which is good, and you get in the book and say, let me see for myself. And then you start reading about MS. Okay. The important thing you're supposed to know about MS, you start reading it, and then you say, okay, I get it. And then when you get on your U word to go and do all these practice questions, then that is also a bonus for you, because you read your book, you listen to some lecture, and you read what the person was saying. You came to your book has a reference to get the whole thing, and then you go back to your U word and get yourself ready to like try these practice questions and see how much percentage you got, whether 60 or 70 or 80%, then you're good to go, right? But you cannot be there confusing yourself. Oh yeah, listen to this guy. The other person say, go listen to that one. That's a lot of time taking it away from you. Go listen to that one. Oh, okay, there's another book over there. Go get that book. Go the books. You I don't care whether it's got Kaplan on it or what. It's the same nursing thing in it. Nothing different from what is in those books. All the same. Especially when in Canada, I just like read Canadian nursing book. Okay, I don't know if you're LPN or RPN, PN, read Canadian PN book. There's a reason why they say Canadian um, practice questions or PN book, Canadian PN exam book. I think you can get that one. I have it on one of my video there, but I borrowed it to someone. Okay, and then this thing and the blueprint. I go in your blueprint. Just read everything they're telling you. Take your time. Take your time. Don't go rush through it and then you say, "Oh, I finished." No, take your time. Go through the blueprint and read every chapter or every subject there. Read what it's saying about that thing. I want to put it up here. Maybe the video will be a little bit long. I'm sorry, but I just want to get this. What did I put in? I just wanted to get this. So we can understand. Okay, hold on. Just give me a second. Let me go get it, okay? I had it up here, but I don't know. Okay, blueprint. Rexp and blueprint. Okay. Okay. Yeah, yeah. They call it test plan also. Okay. And then I'm gonna download it just because of the video. So as you when you download the thing, if you see maybe if you don't know how it look, two beautiful young nurses with their blue uniform on, and then you will come down. It's a lot of things there you read, and then they will say the table of contents there. Just come down, keep coming down. I will explain everything to you what it is and the purpose of this RexPN. It will tell you everything. So this is also with BC if you live in Canada. I don't know. So it will tell you here, they say the test plan structure based on client needs. Okay, that's the part here. Safety and effective control environment. Number one, management of care. They say 18 to 24% of the questions. Okay, safety and infection control. Oh my goodness, I can say safety and infection control, 10 to 16% of coming out of this question that will be coming out of safety and infection control. And then they say health promotion and maintenance, 6 to 12%. Psychosocial integrity, 8 to 14% questions coming out of that chapter. Physiological integrity, and then they say basic care. So physiological integrity, basic care falls under that. So it's a basic care and comfort, 6 to 12%. Pharmacology and parental therapies, 14 to 20%. Reduction of risk potential, 18 to 14%, and physiological adaptation, 6 to 12%. So these are the topics that people telling you, say the questions coming from people. Okay, that's they already list the things that they said. Oh my goodness, like you know. So management of care, when you go down in the blueprint, it's a management of care. You see everything under management of care, which is integrate advanced directed into client plan of care. Okay, advocate for client rights and needs, delegate and supervise care for client provided by others. Okay, so that one that is the ones that like you dedicate some tax to unregulated care providers, organize workload and manage time effective. So all this fall under management of care, and this is on you work. Okay, if you go on you work, you will get that whole thing in depth. Okay, and then you come down, you see everything. It will even give you notes on each of those things that are listed in the management care thing. Okay, and then when you come down, it gives you an example. So it gives you like question, some example question. So it said the nurse has received the following information about assigned clients. The nurse should first assess the client with. So it will tell you, then they have all the questions there. End stage renal disease, who has the serum potassium level of 6.0 mmol over L. So that's the answer over there. So it giving you the question. It's not like the previous one where you have to go through the scenario and then before they give you the question. This one, the questions is straight, no scenario. It's kind of like an independent questions they're giving out. Okay. Then when you come down, I talk about safety and infection control. This is where I like to like talk a little bit on this because most of the question come out of this one. Okay. So safety and infection control, it says assess client for allergies and sensitivities and intervene as needed, promote and educate client on safety and injury prevention, falls or electrical hazard, ensure proper identification of client when providing care. So this is on a safety and infection control. Okay. And it says here, participate in internal and external emergency response plan. Use the economic principles when providing care, safe client handling, and proper lifting on a safety. Okay, follow procedure for handling hazard and hazard materials. Identify practice errors or near misses and intervene. So safely and appropriately use equipment. So this is on a safety and infection control. Okay. And then the last part it says here, educate client and staff regarding infection control measures. All right. And then you follow the policies and procedures for use of restraints. So this is on a infection control. And this chapter you will have say, and they have like 67 questions. Now I remember, I think it's about 67 questions they have. And then when you come down, it gives you a little bit note here and there on everything. Emergency response plan. You go and read it. This is also like a little note for you, like a side note for you, to prepare you. Okay. Home safety. It talk a little bit of home safety. How you assess need for client home modification, like the light, the handrail, the kitchen safety, all those things. They give you a little bit thing for you to know. I did not overlook this thing. When I had the blueprint, I read through the blueprint. I took a day just for me to understand what the people were there, because they had little notes attached to individually what they put in there. Okay. Then they give you an example, like a sample item. They say the nurse is planning to and this is planning or staff education program about Clostridium I'll call it CD infection. Which of the following information should the nurse include? Okay, so you have here the item used in the caring for clients who have the C deficit infection should be clean with household. Like gonna wash your hand with soap and water, and then the saying to clean household thing, you gotta use bleach to kill this virus or bacteria. This thing. Then they give you a sample questions. Okay, after you finish with that infection, safety and infection control, you will come to the next page where it says that health promotion and maintenance. Okay. Within your health promotion and maintenance, the subtopics under those one, they say provide care education for newborn, infant, toddler clients from the birth to 2 years old. Provide care and education for preschool, school age, and adolescent client ages 3 to 17. You see, that is health promotion and maintenance. Then after they give you little question on each of the things I was reading just now, they will give you little snippet here and there information about it. And at the end of their page here, after they give you that little note, then they give you a sample questions. The nurse is teaching about or recommended lifestyle modifications for a client who is at risk of hypertension. Which of the following information should the nurse include? The answer on this thing it says number 4, perform the aerobic physical activity for at least 30 minutes daily for 5 days per week. Okay, so this is health promotion. So I'm going to get back to my video. All right. So I was just trying to go deep into the blueprint. So I start to help promotion. Tomorrow, I'm going to go for the next step because I want you to see what I'm talking about. Maybe I just said download the blueprint and you're like, oh, what is that? And then I was like, okay, you know what? Let me go deep into this blueprint and let me just go topic by topic so they will understand that whatsoever that is in this blueprint is also on your work. On the blueprint, the people, the recipient examiners, what they gave us, they explain. So on each topic, like I was talking about health promotion, they give you, so everything they gave us the sub subtitles, the subtitle, all those things they give you, they give notes for each one of them. Each one of them. It's like a whole study guide by itself beside your books or you work. It tells you little things. It gives you summary of those things. I will call it summary because if this one for health promotion, it will give you little, maybe 2 or 3 line summary on that. The next topic, it gives you 2 or 3 line summary on that, which is good because it's going to build you the little knowledge you have already. It's going to just up it up. Yeah, just put it out there and make you and start growing your confidence. Okay, like, oh, okay, I'm getting this. It's sounding little, little easier to me. So that's where it come in and it start being easy to you because you're putting in more time, and the more you read and the more you put your head in there doing all your static questions and reading in the U word, I mean the blueprint, that's the more it get, like the more it get easier for you. Okay, the more it gets easier for you. Like me, if I'm going back to school to get my RN, I would be right back here doing the same thing, studying too, if I'm ready to do um my anklet. You see, so it get easier when you continue to read the blueprint and you go to your U word, what it's saying to you, that promotion of health, it's the U word. It's there. I'm not stressing this because I want you to go there. I'm not getting no pay from you or I'm just telling you because that's where you can find the best things to study. Like I'm not the best thing to study, but everything you see in the blueprint, you can find everything on your that will give you more knowledge, like more, to know about and prepare you more from the blueprint. Everything on the blueprint, you can find it on your work. That's all I'm saying. I'm not saying that because I'm trying to promote your work. There's no way I'm promoting you. I'm only promoting it for you to go and get your subscription or for a month or 2 or 3 months so you can get with this thing here steady, go take your exam and pass your exam, get your license to practice. That's all I offer. But it's not anything like something behind it. I promoting you word because no, they're not. You can see my my subscriber on here, not enough. But I don't care. I just doing it because I know somebody who will come across this channel will benefit. Not the big things that I'm not condemning anything out there. I just saying I just for me I just speaking from experience. Okay, I only giving you this tip from my experience as someone who studied and took and went in for the first time with the RexPN and make a pass. Okay, so I just telling you what all I did that get me across that line. Okay, that's the same thing. I'm just trying to get in you and make you excited or push you to that limit and say, you know what, if that sister can do it, you know, and she's telling her what to do, let me try. If you can't do all at the same time, but little by little, our people say, drip by drip, it can fill the bucket up. Okay, you can read today one thing, and by the evening before you go to bed, you say, let me look at something again, let me look at it again, and then you read that. Okay, so tomorrow, it's a long video. Tomorrow, I'm gonna go furthermore into the blueprint, and then I will just show you because probably people don't know. They just say, yeah, blueprint, that's it, and just see it and then and pass it. But I just decided, I say, you know what, maybe people not taking the time to just Google this and look at it and go through it and see, you know, what they get talking about blueprint. Like some people will say, I don't have time to look at that. I understand that. Maybe it could be your job or you studying too much, you stress, all the thing. I just want to open it up and just go uh, every page and tell you what it is and tell you, say, hey, this is what it's saying to you, that this amount of percentage of question coming out of this chapter, this amount of question, percentage of question coming out of this chapter. So, and leave it with you. You can take care of the rest because I know you can do it. Okay. There is, I don't care, maybe you try for the first time, you pass it, there's no need for you to feel discouraged and thinking that you can't pass when you go back for the second time. You can, you can pass it, like you can pass for the second time when you get back there. So so I just don't want to make this video longer than what it is already. So tomorrow I will continue to read through the blueprint. And so if you have your U word and you see exactly what I'm talking about, and because I want to encourage you to go check it out. Go check it out because the blueprint is the test plan. It's your shopping list for what you want to go buy. And that's how I would just kind of compare them. It's your shopping list, and what you want to go buy is your exam to get your license. So the blueprint will tell you what all to buy or what all to study from to be successful. Okay, so it can enable you to finish the cross the finish line. Okay, so I just want to say thank you, and please tell your friends, subscribe to my channel. I'm just here giving educational tip, you know, things I know will benefit um, upcoming nurses in school right now, or the ones that are preparing to take your exam. Check it out, listening what I'm saying to you. Stick to what you're doing right now. Don't let anything get to you than what you already started. If you started to say, I have my blueprint, I have my UR, I have my Canadian PN exam book or the Rex PN book, stick to that and keep reading. Stick to that. If you have free time, you want to go listen to other lecture, you can. You can go listen to other lecture. But make notes, bring it, do some comparison, emerges with what you studying from, and make the best out of it. That's all I can say. So I'm just giving you the tip. I just want successful rate for everybody, including myself. Because when someone come and say, "Oh, Rose, thank you," and I pass my exam, it makes me more happier, than charging people for money. You talk to me one on one. I tell you what to do. If you listen to me and you do exactly what I tell you to do, you will pass with flying colors. Now, what the lady that called me this morning that she passed, you'll be just like that. If not listening to no one but doing what that is that before you. Okay. So tomorrow we'll continue with the in-depth of the Rex PN exam, and I will talk to you. Have a good day. Subscribe to my channel. Subscribe. Tell your friends and family and the new graduate out people that coming out, and those that are in nursing school. It's good to start doing things ahead, especially when you get one semester uh, to finish. I know there is a lot of work in school at the end of the, uh, uh, you're about to finish. There's a lot to do, but at the same time, at least you come across my video here or somebody show it to you and just start preparing, listening to what I'm saying. Get these books when you finish with school, and then you just put yourself in a book and start studying the you word and these books that are listed, and you'll see what's going to happen with your determination. I can say, but all rests on your shoulder what you're going to do about it. Because if you take the advice I'm giving you, or you want to overlook me and say, oh, she just get these many subscribers while you are listening to her, that's your loss. I have 5 people already called me to tell me thank you that they passed their exam. I just doing it. I'm not promoting anything here. I just doing it to help you guys out there, Canadian upcoming Canadian nurses and Canadian nurses, so you can get out there and start practicing. That's all. So subscribe, and I'm going to talk to you tomorrow. Have a good day. God bless. Bye. Bye.